In United States, healthcare is one of the largest expenses for U.S. residents. If you're new to medical or healthcare insurance in the United States, you'll find it is very expensive. But cost isn't the only problem for most people when it comes health insurance. It's also a complex system with multiple entry points. Since you can potentially get health insurance from many different sources, such as the government, from your job or university, or from a private insurance company, it's not always clear where and when to start when looking for health insurances. Hi, welcome to Daily Explore, your channel where you can discover and explore the world. Before exploring your options for free or low-cost health insurance, understand one thing. Health insurance is never really free and is rarely truly low cost. Health insurance that's free or low cost to you means one of two things. First, someone is subsidizing the monthly premiums so that you're not paying the full cost yourself. Second, the benefits have been reduced so the coverage you're buying isn't comprehensive health insurance, it's less robust coverage. Here are a few options on how to get free or low-cost health insurance in the US. 1. Medicaid. Medicaid is a social welfare program that provides comprehensive government-based health insurance to low-income people. Medicaid is free health insurance for those who qualify. In most cases, there are no monthly premiums, and there is no or minimal cost sharing in the form of deductibles or copayments. Medicaid works slightly differently in each state, but to be eligible, you must meet low-income guidelines. In many states, you'll qualify for Medicaid if your income is 138% below the federal poverty level. However, some states have stricter eligibility criteria. In those states, you must meet low-income guidelines and also be a member of a medically vulnerable group, people who are pregnant, parents caretakers of a minor child, elderly, disabled, and children. Medicaid may be available to immigrants who have been legally residing in the United States for 5 years or more, if they meet eligibility requirements. Medicaid isn't usually available to undocumented immigrants, although there may be exceptions such as short-term limited Medicaid coverage in emergency situations and emergency coverage for people who are pregnant. Although Medicaid is government health insurance, the vast majority of care provided to Medicaid recipients is provided by private businesses and healthcare providers. If you get Medicaid, you'll likely be cared for at the same hospitals and by the same physicians as your neighbors with private health insurance. 2. Short-term health insurance. Short-term health insurance frequently costs less than comprehensive health insurance. For this reason, it's an attractive option to people looking for temporary coverage. Short-term plans can be sold in some states with terms of up to 364 days of coverage, and in some cases, these plans can be renewed for up to a total of 36 months. But some states do not allow short-term plans to be sold at all, and others place more restrictive limits on their duration. And even in states that don't limit short-term plans beyond the federal minimum requirements, insurers can choose to offer plans that are non-renewable or that have shorter durations. You can buy a short-term health insurance policy directly from a health insurance company, use your own insurance agent, find a health insurance agent or broker at the National Association of Health Underwriters website, or use a non-governmental private online exchange, such as ehealthinsurance.com. 3. Affordable Care Act Subsidy. The Affordable Care Act provides government subsidies to make buying health insurance less expensive for people with modest incomes and to help make both buying and using health insurance less expensive for people with low incomes. In both cases, these subsidies are designed to help people who buy their own health insurance. But this is a small percentage of the population. Most people get their coverage from an employer or from the government. If you have an income between 100% and 400% of the federal poverty level, you may qualify for the premium tax credit subsidy. If you receive this subsidy, the government pays part of your monthly health insurance premium, and you pay the rest of it. If your income is between 100% and 250% of the federal poverty level, you'll not only get government help to pay for health insurance, you may also get additional government help to pay your deductible, copays, and coinsurance when you use your health insurance. This is known as the Cost Sharing Reduction Subsidy. If you're a legal United States resident, you can apply for a health insurance subsidy and enroll in a health plan on the health insurance exchange run by your state or by the federal government. 4. Job-Based Health Plan. Many employers in the United States subsidize health insurance for their employees and their employees' families as part of the employee's benefits and compensation package. This is very common for full-time employees of large companies. It's not as common for part-time employees or for employees of small businesses. When you have employer-sponsored health insurance, your employer usually pays part of the monthly premiums, and you pay part of the monthly premiums. Your share of the premiums is deducted from your paycheck automatically, so you don't have to remember to pay each month. 5. Spouse Health Plan. If your spouse has job-based health insurance, you may be eligible for the same coverage. Most employers extend the offer of job-based health insurance to their employees' spouses, children, and stepchildren. You must sign up for this coverage during the initial enrollment period when your spouse first gets the job. If you miss this opportunity, you'll have another opportunity during each annual open enrollment period. You'll also have an opportunity to join your spouse's plan if you experience a qualifying event, such as losing your own health plan or having a baby. 6. Parents' Health Plan. If you're less than 26 years old and your parent has an individual market plan, purchased on exchange or off exchange, or a grandmothered or grandfathered plan, or a job-based plan that offers coverage to dependents, you're eligible for coverage under your parent's health plan even if you're not your parent's tax dependent, you're married, or you're living on your own. You may have to wait until the next open enrollment period with your parent's health plan to be added to their health insurance coverage. However, if you've recently lost other comprehensive health insurance coverage, you might be able to enroll even before open enrollment if you meet the health plan's requirements for a special enrollment period. That's your 6 options on how to get a free or low-cost health insurance in the United States. We hope you find this video useful. We also provided useful links on the description box where you can read more and find medical insurance. So don't forget to check them out. Does anyone know any health insurance for free? Kindly share them at the comment box below. Don't forget to subscribe and hit the like button if you find this video worth entertaining. See you next time.